let's just spend some few minutes to, or few seconds probably. Let's spend some few seconds to actually greet everyone. It's going to be a very beautiful day. And today's live, we are going to talk about a very, very important topic. So um, let's get on with this and then, all right. So yeah, just a few seconds. So today is going to be my first time streaming on YouTube. And so I hope you guys come around, you come and give me all the support that I need, right? Yeah, just come around. Let me try sharing so that you guys will come and support me. And yeah, it should be. And when everything goes well, maybe you guys will be seeing me more of more on the YouTube streamer than the TikTok one. Yeah. All right. So even though I said it's interesting, we'll be talking about a topic that is very, very how do I call it? It's really pressing. A lot of people tend to have this, but they don't usually know that this is what they might or they are experiencing. So, as a matter of fact, I'll walk you through it, and then we see how best we are going to, you know, understand these images. Let me just place one of my lights, my lovely lights here. Let's see if it's going to show anything. Oh, not too good, but it's okay. Yeah. Okay, so let's get on. Let's get on with it. We are going to talk about a very important topic, which a lot of women are experiencing. It's really, really it's difficult. It's a very, very dangerous disease. But all the same, we are going to try our possible best to get there. So the topic is actually on endometriosis, and if you're a woman who usually experience excessive pain during your menstruation, or there are certain symptoms that comes with this particular thing, but all the same we are going to try our best to get you to understand what we mean by endometriosis, and then if there are questions in the comment section, we try to answer them as well. So let's talk about endometriosis. And as you know, the actual video will be coming out very soon. But for now, let's deal with the topic first. Is that okay? Let's deal with the topic first. So let's talk about endometriosis. So in the first place, let me explain this. Have you realized that anytime there are foreign bodies in your immune system or in your body, you tend to react in a different way? Have you realized that? If you've not realized it, let me show you how it comes. Anytime there are organisms or microorganisms from outside the body and they enter into your immune system, they tend to they are antigens. So immediately they come into your system, your body tends to fight them. This is not a foreign body. This is absolutely how this is your own body cells trying to mess up with your body. Okay, so let's do it this way. Your uterus is lined with what we call endometrial tissues. Now, the endometrial tissues are supposed to be in your uterus, okay, just lying in your uterus. But when you realize that these tissues are moving away from your uterus and then moving to different parts of your body, there is a problem. Now, this problem will lead to several forms of symptoms or several forms of complications. And those are the things we'll be talking about now. Okay, so let's get into it. And then we will understand the entire picture of endometriosis. So when we talk about endometriosis, it's when it's a chronic condition. It's not just once, or it's not an acute issue whereby you tend to see it just like that. No, endometriosis is a chronic issue. So there are people, they are experiencing it all the way back whilst they were children, and then it begins to stay throughout their adult life. Now, it has, or its relation with hormones are very, very close. So it's a chronic condition. It has to do with the presence, or it depends on estrogen. Okay, it depends on estrogen. And this estrogen happens to when you are in your productive period, or you are in your adulthood, right? Puberty age to adulthood or into adulthood. It is a constant secretion in your body. It is a constant secretion in your body. So anytime there is secretion of estrogen, what happens? I want you to type it in the comment section. What happens? Immediately you are secreting estrogen. What is going to happen is that the endometrial tissues that depends on the estrogen will continue to flare up. It's like you are feeding them. It's like whatever you are doing is constantly just going to feed the endometrial tissues. So estrogen will be producing, and then the endometrial tissue will be feeding on the estrogen. So people outside the bracket of production of estrogen, example, menopausal women. In a menopausal person, they don't usually have this endometriosis. And so let's talk about the young females, those who are able to make babies and etc. Let's talk about them. They are those going to experience this medical condition, right? So it's chronic, it's hormone dependent. That is the estrogen dependent. And then when the tissues that are similar to the lining of the uterus, so the uterus is, every woman has a uterus, isn't it? Every woman has a uterus. And so unless you've done something we call hysterectomy, whereby the uterus have been taken out of your body, so the reproductive system doesn't rely on the uterus. Is that okay? So in people who have had hysterectomy, they don't have uterus. So in this case, the endometrial tissue which lines the uterus is going to be absent in you, such a person. I hope we are getting the concept. I'm trying to break it down without medical terms, and then we see. Those who don't have uterus, it's also there, but because we are talking about endometriosis, we will focus on those with uterus. Okay, so the endometrial tissue which grows in the womb and then moves outside the womb and then spread to other areas. Now, this is where the danger lies. This is where it all becomes dangerous. Immediately it moves from there, begins to go to different areas. Now, there are certain areas that endometrial tissues usually gets to. So I'll mention those areas, and then you would understand why you begin to feel certain forms of pains in different aspects of your body or in different aspects of your womb. Okay, so look at this. There are ligaments, or there are certain structures that hold the uterus in one shape or in its stable or state. Okay, now the things that holds the uterus, we have some such as broad ligament, we have other ligaments. The fallopian tube stands there, holds with the broad ligament, holds the ovaries just like this. Now, these, when they are held together, the ovary, or where the hormone dependent areas, that is what the ovarian product, it releases the estrogen. The estrogen begins to feed the endometrial lining. Now, these endometrial tissues are going to spread across from the endometrius or from the uterus and then begins to move around. Whilst they move around, what happens? They begin to deposit in different areas. One, the ovary is one of them. Now, any structure that is in the pelvic region, if you are not fortunate, any structure that is in the pelvic region, if you are not fortunate, the endometrial tissues are going to end up what? Dropping on them. It's just like you've poured rice, grains of rice on the floor. To pick them up, even rice, let's say you'll be able to pick rice up, the grains up, but let's say sugar. Let's say sugar pours on the floor. Picking it up is very, very difficult because it's going to blend or mix with what? The sand particles. So that is how the endometrial tissues spread. When they are spreading, they tend to deposit in areas that are fertile for them. And a very good place where it can get estrogen, where is the ovaries, because the ovaries are producing a lot of the estrogen. So it goes there. It will deposit on the ovaries. That's one. It will again deposit on the ligaments. The one that is holding the uterus together is like connected wires. Okay, connected wires that is holding the uterus together. It's also going to deposit itself on what? On all of them. And that becomes the very, very big problem. I hope you are getting there. I'm trying to make them very minute so that you can understand all these things. I hope that is much more understandable. All right. So some of the other ligaments. So there is a particular structure that protects or covers the entire abdomen. The way you keep on saying that the stomach is next to the intestine, the liver is near, the pancreas is here, the spleen. Yes, there is a structure we call the peritoneum. Now, the peritoneum covers the abdominal cavity. So it's not like you encounter muscles and then after muscles, all of a sudden you are in. Like people will say there is fat, then muscles, then after the muscles, oh, I can see the entire abdominal content. Okay, now the content are covered by this peritoneal cavity. Now the peritoneum, okay, that's what covers it. The peritoneum, if not fortunate, will end up getting some of these endometrial tissues, which these tissues are going to attach the endometrium to other surrounding tissues. So this is covering it. Okay, let me use it from here. This is covering it. Okay, all over like this, the mic. Now, because of the tissues that are present or available, what's going to happen is going to get the endometrium this way to attach itself with the internal structures. What's going to happen? This is what you are seeing. So what's going to happen is you'll be experiencing some types of pains that if you are not careful, you can't use your finger to pinpoint. We call them the visceral pain. So these kinds of pain, a lot of women experience them, especially during their menstruation. Okay, during their menstruation. Because during menstruation, what happens? There is a surge. Okay, there is increase of estrogen reduction, or the progesterone comes down. What did I tell you from the beginning? It's estrogen dependent. So when this is happening, it's like this. Estrogen is up. What will happen? Now, all the tissues that depend on the estrogen will begin to feed on this estrogen. So they are getting food. There is more energy. You will experience excruciating pain. Excruciating pain. And that kind of pain, my dear, you can't bear it. The pain is too much. That kind of pain is too much. I hope you are getting the point. You are understanding what I'm talking about. Right. Let's go further. So let's see what actually leads to these things. What causes it? Because the painful part of everything is that you don't know what is causing it. Now, the first one is there is a theory, we call it the retrograde, retrograde menstruation. Let's give an example. You are a female. You and your partner, you are so sexually attached to each other. You are menstruating. Let's say you started your menses yesterday. Okay? The sad part, okay? You started your menses yesterday, and he came from a journey. Immediately he arrived, he's so much, I'm going to meet my baby girl and stuff like that. We need to have an affair, we need to have sex and stuff, all these things. And so you are menstruating. The lady goes to the bath, she washes down just to make sure the down part is clear of any blood or stuff like that. But he's able to get you into bed, or both of you are able to decide, and then you get into bed. You know what is happening? During your menstruation, the blood contains things that are supposed to be expelled out of your body. The blood that you are pushing out, it's supposed to contain certain things out of your body. Now, it contains hormones, it contains endometrial tissues. Now, these endometrial tissues, that is where the whole problem lies. The endometrial tissues, during penetration, you see the friction movement of the penetration, that's in and out strokes of the penetration. What is going to happen is that kind of in and out tends to take most of the endometrial tissues back into the system. Are you with me? The endometrial tissues that your lining is trying to excrete out of it during menstruation, the penetration is going to push it back into the system. What is happening? The penile stalk tends, whilst it penetrates, tends to allow or cause stickiness of the endometrial lining on the uterus. So what is happening? Right after your menses, there is still going to be those endometrial tissues that were supposed to be out still lying in there. So there is a problem. You may start your puberty life without endometriosis, but as the time moves on, or as the time goes on, you end up getting endometriosis. So you'd realize, let's say 12 years, 13 years, 14 years, when you were menstruating, the pain wasn't excruciating. It wasn't too bad. It was okay. You could handle it. You were going and coming and playing and doing all sorts of things. But now you are 20. Let's say you are very sexual. From 18 years, you are very, very sexual. You are there like that. So when he wants it, you do it. When he doesn't want it, you are not there. When you want, you also want it. And usually, because the hormones are very high, during this period of time, the excitation, the reward system, that's the dopamine, the estrogens, everything is all over the place. And so if you are not careful, you would want to actually do it. With the simplest touch, during that time, you want to be cuddled, you want to, feel safe, etc., etc. And then it gets to that point, you want to do it. So you get on to do it. Whilst doing it, what happens? You leave endometrial tissues down the uterus. And when this happens, it becomes a very, very big problem. We have something we call coelomic metastasis. Now, this is actually cells. Okay, there are the cells of the pelvic area. They transform into the endometrial tissues. And then they begin to go back. They begin to climb up. They begin to ascend, which means that from the down area or from the pelvis area, it begins to climb up, 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 through the uterus, through the fallopian tubes, egg, and there is a tiny hole. If you look at the anatomical view of the uterus properly, you realize that between the egg and the fallopian tube, there's a tiny hole under the fimbriae. Okay, it's just like this there, and there's a tiny hole there which actually causes, all right, it causes the passage to enter into the peritoneum, and that is very, very bad. We don't want that. Now the other one is stem cell. When we talk about stem cells, look, all of us, we have stem cells in our body. What is happening is, with stem cell, there is growth, there is new growth of these stem cells, the cells that are able to grow again. Now these stem cells, and Mullerian remnant theories, these are remnants. When I say remnants, they are like, instead of it's just like you've eaten and you've left some. Okay, the other part of it, or the waste part of it, let's say the waste. Now the waste part is called the remnant. Now after production, after the stem cells have produced their cells, okay, there are remnants that has to be expelled out of the body. In the course of this, these remnants are able to enter, or even during the menstruation, let's say the egg, the release of the ovaries. Now after the release, what is happening down in the ovarian gland itself, or the ovarian organ itself, whatever is remained there, the reason why people tend to get PCOS after the egg has expelled, the space remaining over the shortest possible time, what happens? There is formation of cysts in there. So imagine this place, the egg has been secreted out, so the little hole remaining, the remnants over there, tend to develop up, and then they begin to cause or flare up what we call the endometrial tissues, which then spreads to the other parts of the body. I hope I'm making some sense, and this is helpful to you as well. Okay, let's go on. And with others, we have the immune system, and then the genetic factors. If you are someone who's let's say parents, especially first generation, has experienced some of these things, endometrial tissues, before, then that becomes the one of the risk factors that you may be getting endometrial issues. Yeah. Hi to everyone in the comment section. It's been like I'm in the mood, the teaching mood today. So that is why I'm a bit, it's like I've seen some messages and all that, but I'm so much in the mood. So guys, just stick with me. Yeah. All right. So let's move on. There are certain other factors. We call those ones risk factors. So far as you're a woman, you're at risk of getting endometriosis. It's not like endometriosis, you have to be born with it. Okay, that's not the concept. You don't have to be born with it. You just have to be a woman. So far as you're a woman, you're at risk of getting endometriosis. It's also family history, and also these are factors that please pay attention. If you have a daughter, you have to really take a very critical look. Please monitor when they get to their first menstrual cycle. The first menstrual cycle is very, very important. If you are someone who has early menarche, when I say early menarche, your first menstrual cycle beginning at the ages of, let's say, 11, 12, please, even 12 sometimes is acceptable. From 13 years, we expect you to start seeing your menses and stuff like that. Those who get it at 15 years, 14 years, let's say, it's okay. All right. But when you are experiencing your menses at very early stages, like 10, 11, 12, why is that so? It's so because the exposure of the estrogen is constant on your uterus wall. The exposure is constant. Imagine if my estrogen is secreted, and during which year, let's say I'm 15 years or I'm 14 years, and then there is exposure of estrogen, that is my menses. Now when this happens, it just from 15 years, and someone who is experiencing it at 10 years, how many years? It means before this 15 years is even seen, the uterus is even seeing estrogen, the other child has experienced 5 years of estrogen exposure, which is very, very dangerous. Okay, so when your child experiences their menses very early, you have to be there, show the support that they need, make sure you are there to be with them throughout this entire period. Okay, please. That is one of the other ones. Prolonged periods. If you are someone who doesn't bleed just 7 days, as for you, your menses, it can lapse for about 8 days, 9 days. Please be very, very careful. Go to the hospital, see your obs and gynae. There could be something that has to be done. But if there is nothing, make sure that you are protecting yourself maximally against endometriosis. Okay, it's very painful. Please, those who also have short menstrual cycle. When I say short, we expect you to experience the menses over a period of 5 to 7 days. Sorry, let's say you are experiencing yours about how many days? Let's say 3 days, 2 days. There are a lot of people, they experience their menses just 2 days, just 3 days, and they are done. When this is happening to you, please be very, very careful. Please, I'm begging you. If your menses usually occurs, let's say from Monday, and then just Tuesday your menses ends, or Thursday, up to Monday, Wednesday, your menses ends. Please be very, very careful. Endometriosis might just be knocking at your door. Please be very, very careful. Let's get into the other side of short. So let me mention some of the risk factors so that you understand. So I mentioned, so far as you're a woman, okay, that is one. Also, family history. I talked about it during the genetics and other stuffs. Early menarche. Early menarche is when you begin to have early menstruation. Let's say by 10 years, 11 years, you've started menstruating. Please be very, very careful. Short cycles. If you are someone who menstruates just 2 days, 3 days, you are done. Please be very, very careful. Heavy or prolonged. So heavy is when you can tell you use about 4 or 5 parts in a day. That is one. And then prolonged. Prolonged is when you are menstruating more than 7 days. Immediately it goes beyond 7 days. Please look out. And most often, that by 5 days or 6, 7 days, what is coming is actually not, it's just spotting, right? It's just spotting. So if you are moving beyond that number of days, please go and check. Low parity, someone who is unable to actually get pregnant when you are experiencing these things, please be very, very careful. Let's go to how it occurs, and then I tell you some of the signs and symptoms. How would you know that you have all these things? Let's get more information. Now, with endometriosis, I already told you that it has to do with hormones, right? It has to do with hormones. So endometriosis is actually hormone dependent, and the hormone, the corporate hormone here is what? Someone should type it. Someone should type the corporate hormone. I'm waiting. Someone should type the corporate hormone here. It's estrogen. I don't want us to keep waiting today. I want the questions to come, right? So estrogen is the corporate hormone here. So when we have the estrogen hormone secreting, now go back and listen to all the factors I mentioned earlier, and you would realize when the estrogen is released earlier, what is happening? The estrogen is going to rub out or peel off. It's just like, we are using simple English here. So let's say I have this orange here. Estrogen has been, or let's say I've poured an acid or a chemical on this. What is going to happen? It's going to burn. It's going to burn this yellowish color and then throws it out. Is that okay? It's going to burn this whole color and throw it out. Now, when this happens, it means estrogen has been produced. It has gotten into where the endometrial wall. This wall will peel off. But where is it going? Because the only time the cervix opens for the blood to come out or the menstrual cycle to flow, I will tell you, 1, during your menses. When you are menstruating, the cervix opens. All the time, the cervix is closed. That is the physiological nature of the cervix. It is closed. Okay? It's closed. So when you are menstruating, the cervix opens to allow the blood or the endometrial tissues and the blood from the wall to what pass through the opening. Is that okay? Now let's say it's closed again. When does it open? We've talked about the first one being what? Menstruation. When? During labor. During labor. That is why your midwife would tell you that we have to do vaginal examination. And so they will put the finger there and check the centimeters of dilatation. What dilatation? The cervix. We are checking if the cervix is open. So they will put this finger there to check. And when they check, they'll tell you tip. Oh, it's tip. It's tip. It means that it has started ripening and it's opening. Okay, so immediately they do this, is the tip. Now, as it progresses, it gets to a stage where we say it's 4 cm or 6 cm. Then immediately 6 cm, they will put their finger there and then try to dilate or expand the finger. As they do that, they will tell you that, oh, it's what? 6 cm. At 6 cm, what do we do? Let's move the patient to where? The labor ward. So that is the second instance where the cervix opens. Otherwise, the cervix is always closed. The third instance. Do you remember that anytime you are ovulating, one, you feel some kind of pain? That is a rupture of the egg. From the fallopian tube, there is a rupture of the egg, which comes out. So that pain, when the rupture occurs, there is a pain we call Middlemarch pain. Now, this pain is spasmodic. It's like that. Then it leaves you. And it leaves you. So it happens, and then there is a rupture. Now, the egg is going to come out through the uterus to where? Into the tip of the cervix. Now, what is happening is it needs to come out. Do you remember that you have to, when you are in your ovulation period, you sometimes want to put a pad or a panty liner in your pant in order to pick up whatever is coming out? Is because the cervix opens. When the cervix opens, the fluid will then come and drop here. Now, someone was asking me a question that how does the sperm then go up? If I said it's always closed. Yes, this is the fourth piece I want you to understand. Now, the sperm is a chemical. The cervix doesn't have to open, like, it doesn't have to open itself too much to accommodate the sperm. Bear in mind, the sperms are micro. They are very, very tiny, 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 tiny molecules. And so what is happening is the chemical then communicates with the tip of, or the endometrial wall of the cervix, or the lining of the cervix. So if you can look at this part of my lips, okay, you can see that this part is black, but the slightly towards the inner part of my lip is what? Red. Okay. Now, what is happening here is that the reddened part, that is usually the side where we can see the tip of the cervix. Now, the semen or the sperm then has a head. The head has chemicals. The chemical then immediately it touches the tip of the cervix. It's not just one sperm molecule that is able to communicate. A lot of them come together, they communicate, but it's just few that are able to pass through. The following month, when you are menstruating, the rest will then be picked up, or just within 72 hours, the rest that couldn't enter, those that are not strong. That's why we call it the survival of the fittest. The weaker sperm heads, they are unable to pass through. They then break down and then comes out. So the ones that are able to enter, the cervix doesn't need to open like the way when you are menstruating it has to open, and the way when you are in labor it has to open. It actually requires so much chemical force in order to allow it to open. So that is how it occurs. Now the lesions, okay, what they are going to do, I've told you how it's happening. Now how it ends up is Now that it has spread all over, it has been able to pass through. Okay, the endothelial tissues are now up there. What is going to happen is they want to find comfortable places. They want to find comfortable places. So they begin to move. They begin to look for where they can get estrogen, because I said, well, they are estrogen dependent. Now, some of them grow to the extent that they are able to produce estrogen by themselves, so that they don't need to only depend on the cycle. Is that okay? Because estrogen, it also goes into the blood. In women, estrogen, you get a lot of estrogen in blood circulation going here, going to trigger this part of the body, trigger this, communicate with that part, do that and that. Okay, so some of these tissues, they end up going all the way to different places. Which places am I talking about? One, it can go and deposit on the liver. It can go all the way through the peritoneal cavity, deposit on the liver, but it's rare. Okay, these areas I'm mentioning, they are very rare, but it happens. It can go and deposit in the lungs, because what did I tell you? Entering into the bloodstream. So it gets into the blood, move all the way up, fill up the lungs. It can deposit in the heart. Don't forget, the heart is a pumping machine. What is it pumping? Blood. Where is the blood coming from? We have blood that is systematic. So away from the body, which comes from the legs, and then into the body, which comes from the upper part, pours in the right side of the heart, pumps where? Into the heart, into the lungs. Then the lungs, if it has endometrial tissues, it will stay there. If the endometrial tissues still want to move away, what does it do? The lung will push it into the heart, and the heart will again pump it to all the other parts of the body. Another area, the brain. It can go all the way into the brain. And this is a very, very serious issue. It's very, very serious. You don't need to take it for granted. So let's go to the signs and symptoms. What are you going to see? How would you know that I have this condition, I have that condition? How would you know? Let me tell you. Let me be real quick. Look, this is the first clause I want you to understand. Depending on the part of the body or the part of the organs that this has spread to, depending on the part of the body these molecules have spread to, you are going to have symptoms over there. Let's say it's the lungs. So I'll talk about the uterus and I'll tell you the other things. But for example, it's in the brain. The tissues have entered into the brain. What is going to happen? It's going to compete with the blood. One, it's going to compete with the tissues of the brain, which is the white matter, the gray area. Is going to compete. The nerves is going to compete. So what is going to happen? Whilst competing, those areas that is positioned in the brain, if it's around a part, let's say Broca's area, that's for speech, it means it's going to affect that area. Is that okay? If it has gone to a hearing sensation site, what is going to happen? That part is going to what? Be affected. So you'll be there, you think you are able to hear everything. My dear, there is something happening. Let's calm down. It has deposited in a place where movement. What is going to happen? You are going to lose certain forms of movement. So endometriosis is really a broad topic. So we are just trying to help out. So to everyone who just visited us or who just popped on our live today, we are discussing endometriosis. It's a very, very difficult medical condition that we are trying to talk about. But all the same, I want to say hi to everyone. It's my first live on YouTube. And for TikTok, I think you all know what we do there already. So if you find my video today and you just joined, you can subscribe to our channel. You can also power tap, or you can share your comment in the comment section. Let's enjoy you. Okay, so those who want to join us on YouTube, you are welcome. You can join us. Let's have some fun. All right, so let's go on. All right, so depending on the area that the the endometrial tissues have spread to, those areas will begin to what? They begin to accumulate and then cause those pathologies. Now let's move on to the very, very ones that everyone, those joining, thank you so much. Are there types? So people are asking questions, guys. People are asking questions. So we will try to answer them as we move on. Okay. We try to answer them as we move on. So someone is asking if there are types of endometriosis. There are no types, but depending on the site where you are having the endometrial tissue deposit, those areas are going to present with their signs and symptoms. For example, let's say you know someone who have been coughing for so long. Someone has been coughing. They've been coughing for, let's say, 6 months. They've gone to the hospital. They've done x-ray. You can't see anything. Everything seems normal. Everything is okay. That's what we know, right? Sometimes it gets bad. They place you on antibiotic. They give you a cough mixture. Some guanfacine, carbocysteine, whatever, menthol. You take it in. Now, immediately you take it in, that day, the cough reduces because the medication is going to suppress the irritation. But what you need to understand is this: the cough doesn't usually come with phlegms or sputum. Okay? It doesn't come with phlegms or sputum. What it's coming with is constantly dry cough. This cough is constantly dry. What are you going to think of? I don't know. Is it cancer? Is it this? Is it that? Is it that? You keep on asking yourself a lot of questions. When this happens, what you need to do, we need to go and check. You have to get a CT scan done. A CT or an MRI will be able to pick the endometrial tissues compared to an X-ray. An X-ray won't give you a vivid look or view of that thing. So you may hear that, it's just a cough. But just that I've been coughing for so long. Yes, you might be having these things, but you don't know. Endometrial tissues have traveled all the way from your uterus to your lungs, and you are coughing. Sometimes you may even end up coughing some tinge of blood. That is how bad endometrial tissues can cause. It can go very, very far. Very, 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 very far. Right. So that is one of them. I just give you an example of different places. So let's go. Pelvic pain. That's the first thing. Now, if you're a woman over here, irrespective of whether you have a child or not, so far as your gender is a woman, I'm thinking you might be menstruating or you might menstruate at one point in time of your life. Now, do you remember that whilst menstruating, you were experiencing excruciating pains? These are the pains that I remember. I had a friend, whenever she's menstruating, she opens her leg like this, okay, and lie down on the table. And she will have a fan. She was telling me about it. She will tell me this is what she does because the pain is burning. It's like a burning sensation. She's constantly in pain, and the pain is not even local. The pain is in the pelvis. I know people, when they are speaking to patient relatives and all that, some of them are able to tell you that my daughter, some of them to myself, and they tell you how the pain is bad. It's excruciating. Some of them, they have to call off sick and etc. There are a lot of women who call off sick when they are having their menses. A lot of women. If you are not careful, you might be having endometriosis, but you don't know. So be very careful with that. Okay, so pelvic pain. The pelvic pain is often cyclical. When I say cyclical, it's coming with your menses. It's cyclical pain. It's worse before and during periods. Before and during what? Your periods. There is also it may be chronic over time. I've just said this. It doesn't matter. You may start your menses at the age of 15, but once you've had the tissues, they keep on, making things worse. Also, we have painful periods. I just told you about pelvic pain. Now, painful periods. Painful periods is just what I explained a bit earlier. I hope guys you can see. Please, if you join, make sure you like the video, you comment, you subscribe. Let us enjoy that you are here with us. Okay, let's move on now. Your bowel, look, let me explain something here. There is pain with bowel movement. There are a lot of people, they don't even want to use the toilet on regular basis. They don't like to use the toilet on regular basis, and the reason is just simple. Because there is constant pain. So someone has a question in the comment section. She said, my 16-year-old has very severe menstrual pains. I never experienced that much pain when I was younger. Her 16-year-old. Her 16. Doesn't it fall in line with what we are discussing? It does. It does. And that is very, very serious. So you have to, there are lab tests you have to do. When we get there, I'll bring it up so that you can also enjoy that as well. Can that tissue go? We'll get to the treatment very soon. So once they have spread, they can't go. Let's get there. Hello. Oh, hi. Okay, so let's go on. Hi. I'm on YouTube, so if you want to come, in case this phone goes off, we will be on this one because this is fully packed. All right. And the handle is just my name over there, my account there. You can just fall on YouTube for that. All right. So pain during bowel movement or urination. There are people, when they are going to the wee-wee, they'll be having excessive, excruciating kinds of pain. There's which is usually during their menses. Is that okay? During their menses. Also, rectal bleeding. Let me show you why there will be rectal bleeding. Rectal bleeding, it doesn't mean you are having hemorrhoids or anal abscess or rectal CA. No. Let me show you. You see the space. Let me come again and show you. Look at the space between the rectum. Okay, the rectum like this and the uterus is very, very little. And so when there is a spread, do you remember that when we say someone has cervical cancer? So this is the month of cervical cancer. We'll be dealing with cervical cancer as well. So if you join, please stay with us. We'll be talking about cervical cancer, but a bit later. Yeah. Okay, so the distance between the rectum and the uterus is very, very short. So there is a spread. When the spread is happening, I've told you that in the pelvic area, all the structures are very short. The uterus is there. The eggs, that's the fallopian tubes holding the ovaries, is there. The rectum, when you check the gut, okay, the intestines, when you come down a bit, it's also there. All right, so it's able to spread and then affect all these structures. So you have to be very careful with that. Now, if you know you have sex, you have pain during sex, excessive pain, which means that you won't enjoy it. You are not going to like it. You are not going to enjoy what it's actually happening. So you might not even want to do it. There are quite a number of people who have excessive pain during sex, and it's a pity sometimes. So you need to check that. It can cause infertility. All right. It can cause infertility. There is heavy, irregular bleeding. You can't conceive. There is excessive pain during your menstruation. There is pain when you're having sex. There is pelvic pain in itself. The pain are just too much. Sometimes you feel bloated, and the bloating is because the belly is coming from the uterus. Okay, the uterus will be bulging and then pushing the stomach. Okay, when it bulges in a woman, okay, the uterus is anterior. Now it's going to push because it's bloated, it's going to push the stomach itself, which means that the slightest thing you eat, I'm satisfied. You feel bloated and all that. Okay, and you may be feeling nausea, fatigue, low libido, low mood, anxiety, all these things, you may start experiencing it. What are some of the investigations that you have to do? Let's say you've gone to the hospital quite a number of times, just like I was telling you, in case you are coughing and the cough is persistent. How many months? 6 months. And you still can't find what is happening to you. There are certain labs that you can go in, request for them, and it's going to help you. Is that okay? Good. So what labs are they? We have the transvaginal ultrasound scan. Transvaginal ultrasound scan is putting a probe like this through the orifice of the vagina, enters through, go into the uterus or the tip of the cervix, and be able to shoot not radiation, able to the scan is able to shoot like this and picture the entire uterus. Some, they go inside the cervix. Okay, depends on what method they are using. Goes in, be able to pick up whatever structures are there. So this is like this. It can see and tell you what you're actually having. And this is very helpful. So transvaginal ultrasound, they use it to detect the lesions. Also, we have the MRI scan. With MRI scan, I told you if they do chest x-ray and it's not picking anything, MRI scan is able to pick even the slightest, minutest of things. Because it's in a tissue form, it's like a muscle. Okay, it's like muscle that has been it's torn. Okay, like an accident, and the muscle is in different smaller particles. These particles will be able to be picked up by what? The MRI scan, and that they'll be able to see. And then the definitive, or what will actually help us to say that we are having this is the diagnosis. We have to confirm that this is the diagnosis. We call it the definitive diagnosis. That is a guideline. Now, listen carefully. We have what we call laparoscopy. So most people who have done or who have endometriosis, they usually go for laparoscopy. Now, the laparoscopy can be for diagnosis, and it can also be for treatment. So it's both therapeutic and what? Diagnostic. Now, the laparoscopy, you know how we put recently, or in these days, they will put 1, 2, 3 cameras into your abdomen, and then they will do a surgical procedure. Exactly, that one. That is how the laparoscopy is. So they may pass through the abdomen, pass some cameras through your abdomen, go in there, be able to see that, okay, there is a endometrial tissue here. They'll be able to scrape it. So those who are asking about the treatment, I'm talking about some of them. They'll be able to see, okay, there are tissues here, tissues there, tissues there. Then they scoop it out, or they make an incision around the area, take it out. Move to the next place. Okay, there's some here, there's some here, there's some there. Take it out. Okay, there's some on the ovaries, the eggs. Okay, can we take them out? Well, we can't. That thing goes on. If they can, they take it out. If they can't, they leave it there. So that is when the endometrial tissues become very difficult to manage. At that instance, when they've sent in a laparoscopic measure to take out to diagnose the endometriosis and also to take out the endometrial tissues, and then we can't, what will happen? It becomes very, very difficult for you to actually tell. All right. Now, so that's the laparoscopic one. Let's go to some of the treatment. This one is very difficult. The treatment is very, very difficult. What we do is we will definitely be coming back to this topic because it's a topic of interest. I think a lot of people want to know more about this, but because of the situation we are in right now, we just do it so that everyone has a little bit of idea about it. Is that okay? All right. So let's talk about some of the treatments. We have the non-surgical treatment and the surgical treatment. If the endometrial tissues are symptomatic, we will do something about it. If it's not symptomatic, most often you won't be able to know. You won't be able to tell that, okay, there is something, there is nothing. Okay, so with the symptoms, when you are experiencing pain, what do? We have to give you what we call NSAIDs. These are non-steroidal anti-inflammatory medications. I'm not going to mention the medication. Your doctor is going to do that for educational purposes. That is why we are here. Okay, now the next thing is hormonal therapies. So these are, I told you guys, if you only remember, I told you that it's hormone dependent, right? It is hormone dependent. So please be very, very careful. It's hormone dependent. They have to put you on some hormones. That is why in certain management, sometimes your doctor will just put you on some hormones. Maybe you don't know. Okay, maybe you don't know, but please, you have to know your diagnosis. Okay, you just have to know your diagnosis so that you will understand every single medication you are being treated with. Do you understand me? Exactly. So please know your diagnosis. So they are going to give you some hormones. I'm not going to mention any hormonal medication here, okay? Because it's an educational platform. You have to see your doctors and they will help you. I'm just telling you the classes of things that will be happening. We'll give you pain medications. Those are called NSAIDs, which basically a lot of people are on some of them already. Then we move on to what? The hormonal medications. When it comes to the hormonal medications, there are different types. There are different agents that they use. Okay, so your doctor is going to decide on which one will best fit you. These are the two classes of medications you are most likely to go on. Now, let's move on to the surgical ones. Now, let me say these are supportive care. It doesn't treat endometriosis. It doesn't treat endometriosis. Imagine these muscles have to be bent out, or we have to take them out of your system. So please, if you're a lady, let's say you don't have it, and you know you are very, very sexual during your menses, please advise yourself, because you might be getting yourself into a big problem. All right? Please, and please again, advise yourself. Okay. All right. Now, the surgical ones, we call them the laparoscopic one, because I mentioned that during the investigation that we use the laparoscopic. We go in and then we scoop out, or we have a surgical procedure to take out the endometrial tissues, or we excise them. We cut that area. I told you already, right? I'm just giving these things to make you understand them more. So we excise them, or we call them ablation. All right. We burn them. We go to the base. So like a flower, let me show you something here. Let me use my flower to show you this. So this branch of the flowers, okay, if we want to kill this part of the flower, what are we going to do? Cutting this thing off may still grow, isn't it? Cutting this branch off may still grow. So what we need to do is that we go to the base, or we go to the part where it's at this particular branch attaches to the main tree of a plant, and then we burn it under that part. And then what happens? It dies off. So those on the other machine, please, if you are not liking power tapping for others to see the system is going off, you might then have to come and join me on YouTube. You have to come on YouTube to come and enjoy what I'm teaching here. You subscribe. The YouTube name is still the name I use, my name up there. So you can just go there and then you just come up. All right. So let's move on. It's basically, the treatment is basically the removal of the endometrial tissues. If you are able to remove it, there we go, we are fine. So the supportive care is basically it's mental draining. Okay, so the mental health, the pain management, finding support, staying hydrated, stuff like that. And basically that should help. The complications, we have chronic pelvic pain. because the ovaries have spread to the because the endometrial tissues have spread all the way to where the the ovaries, what is going to happen? There are a lot of women who can't get pregnant, and the reason is because of endometrial tissues. A lot of women, they can't get pregnant because the endometrial tissues have invaded the egg. Why? It's because the eggs are rich in estrogen. The eggs are so rich in estrogen, and because of that, they are unable to actually get pregnant. And it's a pity. It's just because of endometriosis. So I just saw a question, can this lead to cancer? So research proved that a small amount, but this amount is still increasing. Can it lead to cancer? It's increasing amount. So it can lead to cancer. But research has only shown that endometrial tissues would be spreading. The more it spreads, it gets to areas where they can begin to produce their own estrogen. And in that regards, what has it become? It has become cancerous. In this phase, it is producing on its own. It's producing on its own. So it gets to reach areas where they want to actually go. Pass here. And then it becomes something we all don't want to know. All right? It becomes cancerous. So it's a very, very big issue. It can spread to different areas, and that's the danger of endometriosis. Now, I know people are waiting. They want to hear this. After I mentioned the orthodox management to all of us, people are going to be like, okay, so what is the functional bit of it? How can we prevent, how are we going to actually solve this problem of endometriosis with food? Hooray, I'm here. I'm not going anywhere, guys. Come on, let's do the functional bit of it. So there are some helpful patterns, and I'll explain to you. So the first one, it's not a cure. Please understand, the functional part is not a cure. So these ones are able to attack on different stages of the endometriosis. Let's go to the inflammatory one. So what do? We will give you something that is anti-inflammatory, something that can prevent the inflammation from going further. So what do? We are going to give you Mediterranean style. Last time I asked my friends about Mediterranean food, most of them were quiet. They didn't know Mediterranean foods. Go on Google, type Mediterranean foods. There are a lot of restaurants you don't know. They are there. They are all around you, and still you don't know that they are serving Mediterranean foods. So Mediterranean style pattern. Examples. Let's go. Some vegetables, some fruits, some whole grains. These are how the Mediterranean diets are. A lot of vegetables, a lot of fruits, whole grains. When I say whole grains, if you let's take rice for example. Rice, you see, the white rice is not a whole grain. It's a grain, but it's not whole grain. Whole grain must come with the complete nutrients. The husk is on it and all that. Okay, so that is whole grain. We have legumes, nuts. Those who know I like nuts. Yes, nuts, seeds, olive oil, with regular fish and limited processed meat. Okay, these are Mediterranean foods. So bear in mind, refined carbohydrate. So if you know someone having these issues, the video will be on YouTube. You can go and then maybe later share it to friends and people who want it. Okay, and then added sugars. Please don't be taking sugars. Okay, let's go to the omega-3 fatty oils. We have oily fish, which can be found in salmon, sardines, and mackerel. When you open, even example, Example, even the can, when you open the can in a mackerel, you can see that the mackerel has regularly, they have tomato sauce around it, but still when you open it, you can see there's oil on it, because the fish is constantly producing the fish oil out of it. Okay, it's not like it's producing whilst dead, no, but whilst lying there, the extraction of the oil from the fish part, okay, keeps on dripping on the surface of the sauce it lies in. So, and some of the producers, they are really, really good. They add the particular oil they have written on it. They add the olive oil, they add the fish oil, they add the omega-3 fats as well to it. Please, if you know flaxseed, chia seeds, and walnuts, they may also be very helpful when it comes to some of the inflammatory modulators. Okay, let's go to the high fiber diet. This, it always confuses people. People eat things they think or they feel it's fiber rich. Meanwhile, it's not. So the fiber diet is the reason why you are taking a fiber diet is supposed to help metabolism of the estrogen. So the estrogen will be secreted into the body. We require it to be broken down immediately. If you are someone who takes in a lot of high fiber diet, the fiber then breaks down the entire estrogen. So it aids in the metabolism of the estrogen and your gut health. Okay, the fiber diet, you know why the gut health already. You are going to be free in your bowels. It may also improve with constipation. Now, and endometriosis. A lot of women, let me say this, a lot of women are also having constipation as a result of endometriosis. I told you they are able to pass through, and it's because of the dyschexia. There is abnormal forms of pain when they try to pass through. And so they get constipated most of the time. The constipation is because the endometrial tissues have, I used this, right? The endometrial tissues have compacted or have deposited in areas like the rectum, the peritoneal cavity, and even the gut. And when this happens, it's preventing motion of the intestines. Motion of the intestine. Guys, my battery is about to die here. If you want to continue, kindly join me on YouTube. When it goes off, it's done. Okay. So yes, your gut health, bloating. It's also the what was the fiber helps reduce bloating as well. So it's very helpful. Now let's get on limiting highly processed foods. Okay, you have to limit it. You have to limit the processed foods. You go to someone's home, everything they have on their kitchen cabinet is just processed meal. That is very, very dangerous. Please, you should start advising yourself. Some evidence also suggests that higher intake of red and processed meat is associated with increased risk or severity. Increased risk or severity. What did I say? If you are taking excessive amount of red meat, processed foods, it has the ability to cause what? The severity of the endometriosis. So, and that is the painful part of it. A lot of people are solely dependent on these things. You have to manage your weight as well, please. And then there are some individual triggers. Those ones, I won't talk about them. As an individual, you know what triggers you when you are experiencing this symptom, that symptom, that symptom. Okay, yes. And so you have to work these things out. Now, there are certain vitamins, okay? Ensure that you have adequate vitamins in regards to ions, okay? Increase your ion levels, increase your vitamin D levels, increase your vitamin B levels. Your calcium is also important. And very soon I'll come and show you guys how the metabolism of calcium leading to metabolism of vitamin D, which I don't know why they are even calling it vitamin D anyway. There's cholecalciferol, which we have to talk about. So we will get there. Now, if there are no questions, I would like to end now. Whenever you find this video, try to like, share it to others, and let them also enjoy the life. Thank you.